Welcome, everyone. I'm Russell Flannery, editor-at-large at Forbes. We're thrilled to have with us today Dr. Satish Gopal, who is the director of the Center for Global Health at the National Cancer Institute in Washington. Dr. Gopal develops initiatives and collaborations to support cancer research, promote cancer control, and build capacity to fight cancer in low and middle income countries around the world. He lived in Malawi as the only oncologist in a nation of 18 million people. Kind of an interesting footnote to your fascinating career. And we're thrilled, as I say, to have you here with us today. Thanks a lot for coming. So, in your capacity at the Center for Global Health, what would you say are some of the best opportunities in the fight against cancer from that global perspective?
Yeah, it's such a good question. I mean, I think, I don't want to be trite here, but I think to some degree, the first step, I think, is to really treat this with the urgency that it deserves, I think, as a real public health emergency, and especially globally. I think, as you will know, there's a dramatically escalating burden, especially in low and middle income countries. There are many scientific opportunities that are very important for us at the NCI that we think have been relatively unrealized in low and middle income countries. And I think we are still reckoning with the kind of massive destabilizing societal consequences of cancer in low and middle income countries. I really think this is vastly underappreciated. Cancer is going to be the major driver in decades to come of increases in human suffering all around the world. There are major macroeconomic consequences for countries, in addition to the microeconomic consequences that individual patients and families feel. This is a very common cause. Cancer diagnosis is a very common cause of families being impoverished all around the world, even when they had relatively good outcomes from their cancer. Another good example is, I think we're learning more about the millions of children who lose their mothers and the kind of destabilizing effects that has on their lives subsequently, particularly in low and middle income countries where it's very common for young women to die of breast and cervical cancer. So I think we really have to grapple with how big a problem this is globally. And I don't think this is meaningfully reflected in our current levels of investment nor attention globally. I think we talk about this much more than we act. And this is something that we think a lot about at the NCI now, is how, as the largest funder of cancer research in the world, we can play the role that we think we should play in addressing cancer as a global public health emergency that it is.
So let's talk about trials. Of course, we're talking about a large swath of problems and investment returns that could also be generated. But let's try to zero in on trials and how can international collaboration and trials help with the fight against cancer in this group of countries that you're working with?
Cancer clinical trials are essential, and they've played such a critical role in driving progress forward for patients in the United States. And I think the NCI is rightfully very proud of the important clinical trials enterprise that we help to support in the public interest, largely domestically focused. I think the advantage of extending many advantages of extending some of those efforts globally. International collaboration in clinical trials allows us to effectively study rare cancers where single country efforts will have limits. And here it's important to point out that the more we understand about cancer, the rarer cancer becomes. That is, even cancers that we often thought of as a large group, like lymphoma or lung cancer. As we understand the molecular underpinnings of those cancers, we are often subdividing into very biologically relevant subsets. And so that inevitably, to accumulate enough patients with a given type of cancer, the more we understand about cancer, requires international collaboration. The other thing I would say is international collaboration allows us to really foster innovation and efficiency with a lot less encumbrance, I would say, by the policy and practice conventions in any given country. This is true, for example, even when we collaborate with investigators in other high-income countries like Europe, they often have very different ways of dealing with the same types of cancer, the same problems. And I think that tends to unlock a certain amount of creativity when you're able to kind of think with a different lens and with a different perspective. Increasing clinical trials internationally will also, I think, give us greater contextual understanding for addressing cancer in diverse populations and communities in the United States. I think we are realizing, particularly over the last couple of years, the extent to which sometimes our amazing clinical trial efforts, even in the United States, haven't had the reach into particular communities that we may want. And then the final thing I would say is I think there's an opportunity through international collaboration to validate and extend discoveries from the US to other populations, contexts, and health systems. That is, scientific replication is really important. And I think replication under very different conditions really strengthens the robustness of a given finding. And I think there's real opportunities to do that internationally.
Of course, President Biden was associated with the cancer moonshot under President Obama. And the moonshot has been relaunched. How do you size up the progress of the Cancer Moonshot Initiative when it comes to global health and global health equity?
We think the Cancer Moonshot is really important. And so I guess one thing I would say is it's probably important to note that it's still quite early. So President Biden reignited the Cancer Moonshot in 2022, a year ago. And what he articulated was really a 25-year effort. So to reduce, for example, cancer mortality, age-adjusted cancer mortality in the United States by 50% over the next 25 years, which would build on recent progress, but significantly accelerate it. So that means this effort is at least intended to run until 2047. And as you know, the president has requested a substantial increase to the NCI budget to help support some of these moonshot goals, and that's very much still under discussion. However, I think even this early into the effort, and even while some of the plans and resourcing are still being clarified, it's important to say that the momentum and interest, I think, is palpable. And you mentioned my pre-NCI life when I spent my academic life living and working in Africa. Actually, in 2016, when the original Cancer Moonshot that then Vice President Biden led was announced in President Obama's State of the Union in 2016, I was living in Malawi, and we felt the ripple effects there. I actually wrote about this at the time in the New England Journal of Medicine. And it's clear to us that the momentum and interest, I would say, is very palpable, even at this relatively early stage. And it's certainly clear to us that global collaboration and equity are major themes. And we've been incredibly grateful to have the opportunity to work so closely with the White House on strategizing about what some of the important global health opportunities might be. I guess the other thing to say is I think this level of political commitment and visibility is perhaps unprecedented. I mean, I'm not sure that there's ever been an American president as deeply committed to the problem of cancer as the current first family is. And I would say the importance of that is very difficult to overstate. We are finding that this really engenders similar commitments from other partners. And so even over the last year, a little more than a year since the Reignited Cancer Moonshot was announced, we have been deeply engaged with partners in the European Union, with G7 countries, with partners in Ireland and Northern Ireland that we've been working with since the Good Friday Agreement, with African leaders through the US-Africa Leaders Summit that was convened in December, recent state visits from heads of state from India and the Republic of Korea, with the World Health Organization, which for the first time in recent years has had major programs focused on cancer specifically. So I think it's this kind of political support that is engendered, I think, by a moonshot-like commitment is really galvanizing for the community. And it's especially galvanizing, I would say, for those who are working in countries that may not enjoy the sustained support for cancer research that we enjoy in the US. There are often remarkable people doing remarkable things, and overcoming immense odds to try to accomplish progress against cancer in countries where that's very difficult to do. And again, we're so fortunate in the United States to have had sustained, strong bipartisan support for cancer research and progress against cancer in the United States. And I think enabling some of that same commitment and visibility in other parts of the world, I think is a rather important feature of the current Moonshot.
How would you say that equity, global health equity, figures into the fight against cancer? You were talking about the high percentage of breast cancer cases in some developing countries relative to global averages, for instance.
Yeah, so many people have different, I think equity has many different definitions. I tend to have a fairly particular version of it, I think largely driven by, my own personal experience that you described. And before coming to the NCI, I was, my academic life was spent living and working in Africa. And I often say I was really dealing with cancer in settings that had perhaps some of the lowest levels of cancer resources and expertise anywhere in the world. And then I had the opportunity, and I was doing what we thought was really important work with the NCI's support, and then moved to the NCI 3 years ago, which I often think of as the world's leading cancer research institution, and perhaps the place in the world where cancer resources and expertise have the highest concentration. So this is, to me, a pretty remarkable journey. And I think being now at a research institution and helping to shape the global health agenda at the world's largest cancer research funder, I really think about equity as allowing all people to have the opportunity to contribute to and benefit from cancer research, rather than just some people in some countries. This was the main thing that I think we accomplished when I was working in Malawi, for example, with NCI support. Patients there who I took care of had no idea that the cancer research enterprise had anything to do with them. They didn't think that they could benefit, and they didn't think that they could contribute. And again, a lot of the work that we did with NCI support really allowed us to shift that feeling over time, where patients were excited to enroll in studies and felt proud of the knowledge that they were helping to generate on behalf of other people. And I think that for us at the NCI, we're really the evidence generators, right? We have a responsibility, I think, to generate evidence that informs practice and policy globally as the largest funder of cancer research in the world. And I think we think a lot about how to do that over the short, medium, and long term. This is, I think, a topic of active and vibrant daily discussion that we have amongst our scientific leadership across the Institute and with our broader community. I would say NCI is really one part of the ecosystem, but we're a very, very important part of the ecosystem, I think, not just in the US, but globally. And I think this is acknowledged in the Moonshot and also the recent National Cancer Plan, which our NCI director, Dr. Monica Bertagnoli, has put forward, which are really intended to galvanize an all of government, all of society approach, but with research being a real foundation of everything that happens around it. And I think if we do our job well at the NCI, we can really make things happen across the ecosystem. That is, evidence can often lead to access, and sometimes access is very difficult to achieve without a strong evidence base. I think we have seen this, for example, with HIV, where that has been transformed, I think, from a death sentence to a manageable chronic condition all around the world. And I think that's an example where early on, where people were really debating about what the viability of HIV treatment provision in rural Africa, for example, might be, the research community had played a really important role in demonstrating this can be done. This can be done even under these conditions. The outcomes can often be the same as we experience in the US with, at a much higher expenditure and infrastructure level. And I think that can be very powerful. And I think we're, thinking a lot about how to play some of that role at the NCI in relation to global cancer.
Yeah, fascinating. And of course, very important for its impact around the world among many different nations, and also for the U.S. interaction with those countries. So fascinating work. Good luck with it. Thank you very much for joining us.
Thank you for having me.